In step 1, the grapple position, the rhomboid major, pectoralis minor, and rhomboid minor are activated. The origin of the rhomboid major are the spines of the upper thoracic vertebrae. The insertion of the rhomboid major is the medial border of the scapula. The action is retracting, elevation, and rotation of the scapula. In the region of the upper limbs, we see that the biceps brachii, the coracobrachialis, and the supraspinatus are activated. The origin of the coracobrachialis is the coracoid process of the scapula. The insertion is the shaft of the humerus, and the action is flexion of and abduction of the arm. In the hands, we see that the pronator teres, the supinator, and the palmaris longus are activated. The origin of the supinator is the lateral epicondyle of the humerus. The insertion is the lateral surface of the radius, and the action is supination of the hand. In the legs, we see that the pectineus, the gracialis, and the adductor longus are being moved. The origin of the pectineus is the spine of the pubis. The insertion is the femur distal to the lesser trochanter, and the action is the flexion of the and adduction of the thigh.
In step 2 of the throw, the muscles that are being used in the neck, shoulders, and back include the levator scapula, the latissimus dorsi, and the trapezius. The origin of the trapezius is the occipital bone and spines of the cervical and thoracic vertebrae. The insertion of the trapezius is the clavicle, spine, and acromion process. The action of the trapezius includes it rotates the scapula, raises the scapula, pulls the scapula medially, and pulls the scapula and shoulders down. The muscles used in the arm of the throw include the deltoid, pectoralis major, and teres major. The origin of the deltoid is the acromion process, spine of the scapula, and clavicle. The insertion includes the deltoid tuberosity, and the action is it abducts, extends, and flexes the arm. The muscles used in the hand when throwing include the brachioradialis, the brachialis, and the pronator quadratus. The origin of the brachioradialis includes the distal lateral end of the humerus. The insertion is the lateral surface of radius, and the action of the brachioradialis is it flexes the elbow. The muscles in the legs, hips, and abs that are being used when throwing includes the rectus abdominis, gluteus maximus, and rectus femoris. The origin of the rectus abdominis includes the crest of the pubis and pubic symphysis. The insertion of the rectus abdominis includes the xiphoid process of sternum and costal cartilages. The action of the rectus abdominis is that it tenses the abdominal wall and compresses abdominal contents.
Step 3 is of the pinning position preceding the throw. Movers of the neck, shoulders, and back include the latissimus dorsi, rhomboid major, and serratus anterior. The origin of the serratus anterior includes the outer surface of the upper ribs. The insertion is the ventral surface of the scapula, and the action is that it pulls the scapula forward and downward or raises the ribs. Movers of the arm include the pronator quadratus, brachioradialis, and supinator. The origin of the pronator quadratus is of the anterior distal end of the ulna. Insertion is the anterior distal end of the radius, and the action is that it rotates the forearm medially and pronates hand. Movers of the hands include the flexor carpi radialis, flexor carpi ulnaris, and extensor digitorum. The origin of the flexor carpi radialis is that the medial epicondyle. The insertion is of the base of the second and third metacarpals, and the action is that it flexes the wrist and adducts the hand. Movers of the legs, hips, and abs include the transverse abdominis, external oblique, and gastrocnemius. The origin of the external oblique includes the outer surface of the lower ribs. The insertion is of the outer lip of the iliac crest and linea alba. The action is that it tenses abdominal wall and compresses abdominal contents.
The bones involved in step 1 of the grapple position are the cervical vertebrae, the scapula, and the clavicle. The bones involved in the arm movements are the humerus, radius, and ulna. The bones of the hand are the metacarpals, carpals, and the phalanges. In the legs, we have the femur, tibia, and fibula. In step 2 of the throw, we see that the bones of the neck, shoulder, and back are the acromion process, the sternoclenoid cavity, and the thoracic vertebrae. In the arm, we have the intertubicular groove of the humerus, the radial tuberosity, and the coracoid process.
The bones involved in the hand include the trapezoid, pisiform, and capitate. The bones involved in the legs are the ischium, coccyx, and patella. In step 3 of the pinning position, the bones included in the neck, shoulders, and back are the axis, atlas, and the lumbar vertebrae. Of the arm, they include the head of the humerus, olecranon process, the neck of the radius. The bones involved in the hand include the proximal phalanx,
The middle phalanx, and the distal phalanx. The bones involved in the legs and hips are the acetabulum, the sacroiliac joint, and the iliac crest.